Welcome back to Power Lunch. Former CEO of Medtronic, Bill George, is still with us. Darnisha Harrison, CEO of a pharma company, also still with us. Let's bring in Jim Thornton, a contributing writer for American Thinker and a longtime venture capital investor in the sector. Jim, good to see you. Good to have you here. You saw the interview this morning. Do you think she defended the price of EpiPen?
I think she did a good job. I'd give her a B. The company, from what I can see, is really in a harvesting timeframe, a harvesting part of their product life cycle. In 2025, the patents expire, and I know Sandoz is actively trying to undermine it. Company in 2017 is really going to see, at this inflection point, 4 generic competitors coming back into the market, one of which Bill mentioned was Teva. The other is Adamas Corporation, and then we have existing emerging generic coming from IPXL, who makes a product called Adrenaclick. And I think that articulating that part of the argument would have been beneficial, more beneficial for her. Adrenaclick is a list price in the $390 to $450 range versus what their $600 list price is.
Saying the competition. What about her focus on the supply chain and the middlemen? Did she make that case? Is that justify? Does that justify her putting a list price of more than $600 on this?
Very valid. Having experience with the distribution channel and PBMs, they have their return criteria. If you, as a drug manufacturer, marketer, want access to their base of customers, you've got to hit their return criteria. Same thing with the managed care companies. They want to negotiate the best price. So you have 2 constituencies to deal with, the retail distribution channel and the managed care.
What's a return criteria?
Can you walk us through a product and to explain exactly how that works? Just a hypothetical.
Well, I've been in front of buyers who actually they said, listen, if you want it on our formulary, you want it on our shelf, it's a 40% margin for us based off the acquisition price. So, you get into all these negotiations, and they're quite complex. So dropping the list price, a one-sided drop of the list price really complicates a lot of the managed care contracts that Mylan would have, a lot of the criteria that retail, drugstore, distribution partners and PBMs would have. It really would create an additional firestorm for her. This, in a year and a half, is going to be a different market dynamic taking place if those 4 companies, and they are moving quite rapidly, are going to change, come to market, I should say. So, that's the way I look at it. There's a number of other factors to look at. I would have liked to have her explain that a little bit more, but,
I don't understand why dropping the list price would cause her trouble with the managed care companies. Explain that dynamic. So you explain the retail, okay, if I'm going to distribute your product, I'm going to make 40% on it. That's where their price starts. But what does that have to do with managed care?
Well, remember her comment. I think managed care would be okay with it. But remember her comment, she says, not everyone would get access if we dropped the list price. So that gets back to access to the product, because the distributors, the actual retail locations, that now, because of the price drop, wouldn't get their return criteria, may not make that product available. They may pull it out of their
They just wouldn't
formulary.
Carry it.
Right. So she wants to make this generally available, which she is doing. I mean, the company went on.
But this is the only product out there, right? I mean, the argument is that there is a monopoly, whether created by the government or not. Effectively, they have a monopoly because Auvi-Q is off the market, recalled, and Adrenaclick is capacity constrained. They can't make enough of the stuff. So you're telling me that a company would actually say, we won't carry EpiPen because the contract is violated?
Can I add a comment here?
The margins are not there. I mean, it's, they're not run for, they're not charitable retail distributors.
Go ahead, Bill.
Sure.
Jim, I have a lot of respect for what you do as a venture capitalist. Thank you. We need you to fund companies like Darnisha's. They're the lifeblood of this industry. But having said that, I don't agree with you. Tylenol gives a huge margin to Walgreens when they sell through there. And it's natural that any product, an OTC, a generic product, there are margins. This is the role of distribution. This is nothing unusual. And I don't buy it at all that if the price were lower, that people would have less access. I think it's just the reverse. You get the price up so high, people can't afford it. Keep the price low. That's why I say roll back the price. commit to no further price increases, and get back to innovating on the next generation EpiPen or whatever is needed
there's so many
for
guys,
children like
Yeah,
Darnisha's doing.
the reason why, Bill, is such a huge firestorm today is really gets back to the regulatory aspect. We mentioned competition and the FDA approvals, but the other part of it is Obamacare. If you have an Obamacare-approved bronze or silver plan, the first $3,000 to $6,000 you have to come out of pocket, your individual health insurance plan. That means 20 million people have to come out and pay that amount. So, you know, that's really what's causing this firestorm. 5 years ago, when it was $150, yeah, it wasn't such a big deal. Today, at $600, it is a big.
No, let's one fact and then one stat and then a question to Darnisha, okay? Because here's the reality. I was just doing this at the commercial break. Revenues, guys, for everybody. Aetna, Cigna, the PBMs, CVS Caremark, Express Scripts, Mylan, they're all up big in the last few years. So let's be clear.
Sure.
You don't have to have an opinion. Everybody is making more money except the consumer who's spending more money, like Jim just talked about. There's your disconnect.
And Tyler was talking. We were talking about what percentage of the S&P 500 all these prescription benefit
of the
managers.
Fortune 500, 7 of the top 25 companies are either in the drug distribution or pharmacy benefit business, from McKesson to Cardinal to CVS to all the rest. That was not the case, I will wager, 10 years ago.
I want to get to Darnisha here. Darnisha, I know that you're clinical, you're a young company, so you're not going to slam the government because that would be probably bad for you. However, you mentioned Adrenaclick, capacity constrained too, but you know what else? Somehow there's a law or a regulation. Adrenaclick apparently has 2 caps you have to remove to use it. EpiPen has 1.
It's easier. It's
Pretty
said
much
to be
the
easier.
only distinction. But because of that distinction, you have to have a new prescription for the Adrenaclick instead of the EpiPen.
Right, it's not interchangeable. Whereas
Which,
the
because of
Teva,
the caps.
Teva one,
because the caps.
right, no, I understand. No, but we're talking about a
compliance.
direct interchange, and that there is no direct interchange for EpiPen on the market.
But my point is, there's an example where you've got seemingly an innocuous difference of a difference in caps, effectively helping create monopolies.
Yes.
No, I think this is not a
Let me let Darnisha
generic.
answer the question. What's the difference between safety and stupidity?
Well, here's
Getting
what
too
I will
close to the
say.
cliff?
Here's what I will
For the
say.
photograph.
There is a competitive advantage here with EpiPen. I mean, hands down. And I do believe that Mylan will ultimately make the ultimate right decisions. But you've got to be able to play, and I stay consistent with this, the long term and the short term. And how do you do that? And that's by having a very rich, innovative
You say they'll make the
pipeline.
right decision. What is the right decision?
The right
is it?
decision for patient-centric and the balance of, and that's the long term, in my opinion, the unmet needs, who are the patients that need this product, and giving them access, and then you balance
But
that
embedded in
with-
that answer is that they're not doing that right now. They're not patient-focused right now, and they haven't made the right decision right now.
And I think that long term is really hard to stay
let me just
patient-focused
say-
if you
Guys,
don't have the right innovative
We got to go,
pipeline.
Bill George. I'm so sorry. It's been a good discussion.
Stop passing the buck, guys, and roll back the prices.
Roll them back.
Profitability is good.
The market
more
will
profits
fix
you
itself
have. Thank
in
you.
18 months.
All right.
Cut out the middleman.
Thank you, ladies and gentlemen.